Finish up talking about the female pelvis, looking at a few more examples of some pelvic pathology, and then we're going to move into fetal imaging just to touch on that a little bit for you. So looking at this image, I want you to just take a moment and see if you can identify what the abnormality is. This is just a conventional radiograph. And so hopefully the first thing that you notice is when you look at the symmetry left to right at both the pelvic brim as well as or the iliopectineal line here, as well as along the two obturator foramina, you'll notice that there's this discontinuity, or this asymmetry between the two sides. So here is the location of a fracture along the pubic bone. And then it's much more subtle, but also if you look up here in the first off, this is the zoomed in view of the fracture there. And then up here, if you look again, kind of compare the two sides here, and you'll notice that there's this abnormality right through here within the sacrum. And so this is another fracture that's located there. Again, usually a lot of the time you see them on opposite sides of each other, but here in this example, you can see that the fractures occurred on the same side. So let's look at this now in a cross-sectional view from a CT scan. And so I think from this view, you can much better appreciate the location of the fracture on the sacrum. So here it is right here. Again, if you look at this side, you have this nice smooth surface. Over here, you can see where there's kind of this notch in it. And so that's where you can see the benefit of CT versus conventional radiography. It's much easier to pick up on these small fractures, like this example of a sacral fracture. All right, so this is an example of the most common ovarian neoplasm found in patients younger than 20 years. So this is what's called a cystic teratoma. So you can, or a dermatoid cyst. So here you can see that located right here within the pelvis of this female. And then looking at a CT cross-sectional view of an ovarian dermoid cyst in another patient. So again, this is that cystic teratoma that I mentioned just a moment ago. So here it is right here. And you can see in the middle, there's this calcification, which is usually a tooth or tooth-like material. And so the reason that these form is they arise from usually an ovarian follicle, and so that as a result they have all layers of, or multiple germ cell layers are present, and so they can have any number of different types of tissue. They can have they commonly have thyroid tissue, bone, hair, tooth material, etc. So they're sort of like a malformed fetus almost in some ways. So this is a removed cyst where a mature dermatoid or dermoid cyst. So you can see right here the entire size of the teratoma, and then this is the inner surface where you can see some hair growing, and you can see a couple molar tooth that have also developed, or teeth that have developed there as well. This is another example of a mature cystic teratoma, and so from the ovary. And so this one you can just appreciate the amount of hair that's developed within the tumor itself. Okay, now we're going to just finish up with fetal ultrasound. So these two images are one's transabdominal, one's transvaginal. So the ultrasound is actually the primary method we use now to assess female pelvic viscera. So there's a couple reasons for that. Number one, it's cheap and easily accessible. It's also, there's no radiation, so there's a significant risk with pelvic radiation in females. Oftentimes they don't know if they're pregnant, and so at least in the early stages of pregnancy, and so there's a significant risk if you irradiate a fetus with that much radiation early on, there's a very high risk of causing significant issues for that developing fetus. And so as a result, we try to stay away as much as we can from X-ray and other modalities that are going to expose a female to that radiation. So ultrasound then is our modality of choice. It's cheap and accessible, and you can appreciate the pelvic viscera quite well in ultrasound. And so we're going to just look here at some of the fetal ultrasound. So, and again, as I'm sure you're aware, there's two different ways by which we can image the female viscera in the pelvis. One is going to be transabdominally. The other one is going to be transvaginally. So the transvaginal is actually a much better approach because you can use a higher frequency probe, so you can get higher resolution on a transvaginal ultrasound. So usually we start with transabdominal and then we'll move transvaginal. It's obviously less comfortable for the patient and whatnot, and so we always start with a transabdominal. So up here you can see the bladder right here with a Foley catheter that's been placed within it. So you're kind of seeing the outline of the Foley catheter there. And then right next to it here in the uterus, you can appreciate there's a germ sac along with a fetus, a small little fetus that you can see right here. So then when you look at it on via transvaginal ultrasound, you can now even appreciate the yolk sac, which is this little cavity that you see right there. And then this is the crown rump length right here. And then the little plus sign that's been placed over here, that just indicates the fact that the technician, the ultrasound technician, observed fetal heart motion. So at this point, the fetus does have a heartbeat. So remember that happens very early on in the developmental process. And so we're able to pick up on that at about 6 to 7 weeks, usually on ultrasound. So here we have a little bit further developed fetus, but again, you can get a sense of so the E stands for embryo. So this is the entire embryo right here. So this is all the uterus where it's positioned. The bladder is going to be over here. And then you can see how we are able to date a fetus based on the crown rump length. So this is going to be what we'll measure from these two plus signs across to again get an approximation of how old the fetus is. Another way that we can age a fetus is by the interparietal distance. And so here you can see where we're trying to measure the head of the fetus going across. Again, this is going to be the head right here. And then we also are able to perform three-dimensional ultrasonography now. And generally, we don't use it on a traditional pregnancy. The reason is that ultrasound does heat up the fetus relatively significantly. And so we try to stay away from doing that as much as we can. There are a fair amount of commercial entities, though, that do this 3D ultrasound. You can see it produces a pretty cool picture. It can be really useful, though, if we do detect any abnormalities via conventional ultrasound. It's usually helpful to then switch over to a 3D ultrasound to get a little bit more detail of what's going on with the fetus. So again, you can see how this would be quite useful diagnostically. All right, and so now we're going to look at a couple of examples of ectopic pregnancy. So on the left side, you can see an example of the uterus without any fetus within it. Over here on the right, you can see where we have an embryo right here, and then you can see sort of this cystic fluid that has accumulated outside of the uterus as well. And so that usually is sort of a worrisome sign that there's a high likelihood that this is an ectopic pregnancy that we're looking at. So looking at another view of this, we can see this is a transabdominal ultrasound right here. So again, you can see the bladder, you can see the vaginal canal, the cervix, and then moving into the uterus. And just posterior to the uterus, you can see that there's this additional mass that's been detected here. And so when we switch over to a transvaginal view, now you can see the germ sac as well as the fetal heart rate or fetal heart motion. And so again, this is relatively rare to actually see an ectopic pregnancy where there is a fetal heartbeat, but where the fetus is actually viable, but it does happen. And so this is an example of what that might look like. This is another example, not of an ectopic pregnancy, but of an abnormal fetus. So this is an example where you can see the body of the fetus over here on the left. The head or the face of the fetus is right here. You'll notice how the rest of the head is missing. You don't see a brain. And so this is an example of anencephaly. This next image here, this is showing you can see the spine coming down this way. And so you'll notice that there's a meningocele located right here. So this is an example of spina bifida, which is one of the big things that we're looking for on fetal ultrasound. And then this is just kind of fun, but this shows you a couple of multiple pregnancies. So you can see on the left, there's an example of triplets. And then over here on the right, you can see an example of twins.